I developed preeclampsia at 28 weeks gestation. It was an accidental finding in that I'm a registered nurse and was at work on the day, had been feeling unwell, and one of the registrars, one of the junior doctors I was working with actually said to me, "Oh, what's your blood pressure?" And I thought, "Oh, I don't actually know. I had checked it 2 weeks earlier at the GP and it would have been fine." So went to the tea room, did my own blood pressure, and went, "Oh, okay, that's quite high." And went straight to the labour and delivery ward at St George Hospital, which was where I was working, and explained that, I'm obviously pregnant, this is my blood pressure, I don't think that's normal, what would you suggest? And I didn't end up going home again until I'd had Edith, my daughter.
There's very little data in the literature around women's health after they've had hypertension in pregnancy, and as far as I know, this is the only study being conducted looking at women's health, both physical and mental, after they've had hypertension in their pregnancy. So it's really important information we're gathering here, and it's going to fill a much needed gap in knowledge.
There's just so much that we don't know, and given that, had my experience happened with, say, my mother 30-something years ago, she quite probably would have died.
Hypertension in pregnancy affects about 10% of pregnant women. Preeclampsia affects about 3 to 4%. Because we are providing these women with a much more continuous and collaborative approach to their care, that they are not as concerned and therefore are less likely to end up with longer term psychological issues as a result of their complicated pregnancy.
Lynn's study has the potential to make a real difference to women around the world. For the first time, we will have the evidence about the mental health impacts for women after they've had this condition, blood pressure in pregnancy. So we will now be able to ensure that women are cared for during their pregnancy, that they get the best possible follow-up after they've had their baby, and that they can go into their next pregnancy in the healthiest possible way.
Perhaps if this knowledge was known when I had my baby, my time may not have been as traumatic as it was for me. And for me to be part of a study that's going to have such an impact on women's health makes me feel really special.